Hey, how's it, Hawaii? And welcome to another edition of the Weekly Dose. I'm Brooks Bear. I work here for the Department of Health. And you've heard a lot about data over the past year plus, ever since the pandemic began. There's all kind of information available about COVID cases, about vaccination rates, about how many vaccines are administered daily and weekly. There's so much information out there. Sometimes it's hard to digest, and sometimes it's even hard to find. So today we want to spend a little time showing you how to easily find the data that pertains to the pandemic here in Hawaii. And also we're going to have a couple of experts on to explain what the data means, why is it important, and again, how to find it, because if you haven't found it, it's no good to you. So I'm going to start by sharing my screen with you, and that's pretty simply done. I go here and I go here and I click on that, and suddenly you are seeing a Google page. And to find the data dashboard from the Department of Health, it's actually produced by our Disease Outbreak Control Division. But to find it, just simply open a Google page and Google Hawaii COVID data. And lo and behold, this is what you see. Scroll down just a smidgen to the first display that comes up, or words, and they say Disease Outbreak Control Division, COVID-19 Hawaii. Give it a click, and it's that simple. You are now on the Department of Health data dashboard, and I spend a lot of time on here, but it was recently updated. There are new features. Some of them I am completely unfamiliar with, but I must familiarize myself with them. And to help me do that and to help explain it to you, let me bring on today's guests. We have epidemiologist here at the Department of Health. I call him our data guru. His name is Josh Quinn. Hey, Josh.
Hey, Brooks.
All right. Thanks for joining us again. I appreciate it. And we have another epidemiologist. She's a data specialist at the Department of Health working for Josh. We have Haley Maeda. Haley, welcome to your first edition of the Weekly Dose.
Hi, thanks for having me.
Good to have you here. Now, Josh, before we get into some of the particulars and the nuances and the details here, give me kind of what the whole purpose of this dashboard is. I mean, how is it used? Why is it important? And what information do we hope to display in a nice, concise manner?
Yeah, so ever since this pandemic started, we recognized that we needed to have communication to let the general public, members of our community, know what's going on in their community, what is their risk, what are the trends. And because even as vaccination has gone up, cases have generally been trending down the past few months. We know that COVID is still in our community, and we need to stay vigilant and can adapt and adjust our behaviors as the situations change in the coming months, because it's a constantly evolving situation.
And before I learned too much, we thought, well, let's bring the experts on and let's have me be the guinea pig, and I'll kind of crawl around on the page and ask questions about things that interest me, that may confuse me, so you can guide me in the right direction. And Haley, I think you're going to be my tour guide.
Correct. So here we have our first, our main view, the summary metrics view, which kind of gives us an idea of what's happening within the state, but also within each county. So on the left side, we can see, the daily new cases, which is a 7-day average showing 46, and then also as well the test positivity. And then along below it is a graph showing sort of like disease activity in the past 14 days. A new addition that we've added to this view is the completed, those who have completed vaccination. So we see the 58.1% who have completed vaccination. And then to the right, we can also see we can see the situation for each county: Hawaii County, Honolulu County, Kauai County, and Maui County. In this view, we also have in the top right the info button, which can give us more information behind each of the metrics that are displayed. You can go ahead and take a stroll through this beautiful website that Josh has worked on. And then if we go back to the dashboard, we can also see towards the bottom that we have navigation buttons that take us to other views. So if we go ahead and click on the map, we have the the COVID case data for by map, and then in the top part of it, we can see the different metrics. So on the top left, underneath select metric, you can go through and see cases in the past 14 days by zip code, and then also cases per 100,000 in the past 14 days.
I got you. So the map's cool. I mean, I'm a map guy. I grew up being a map guy. I like looking at maps of the world. I like looking at maps of Hawaii. I like knowing different neighborhoods and streets and all that kind of stuff. But how about the Epicurve? The Epicurve is something that has been talked about since the very beginning of the pandemic. We all saw Dr. Fauci saying we've got to lower the curve, flatten the curve, right? This is what he's talking about. Haley, tell us about the Epicurve. I mean, what's the significance? And boy, did things look ugly back in September and August.
Yeah, so the Epicurve gives us a daily count of cases for each day. And recently we also added in probable cases. So we can see that the curve has, two kind of aqua and blue colors. And then in the orange, we can see the the 7-day average of case counts, which gives a better idea of what's happening, with taking out the variability of sort of day-to-day variances. But we can also...
I was going to say, I really like being able to drag my cursor across, and you can pick a day. Did you want to know what was happening back on this says on Tuesday, May 4th of 2021, there were 122 new cases that day. That was not a particularly good day, but you can advance forward to, more recently. Here's July 2nd, 45 new cases. And you can see, you follow that red line, and, that was last August, September, at the peak of the pandemic here in the islands. And then we had, things were not too rosy in early January either. But then we got the vaccines, and look what happened as the vaccines rolled out. People began to get vaccinated, and the case counts have gone down to where we are averaging 46 cases a day as of today. Over the last 14 days, 46 new cases a day statewide. But then we can zoom in on, let's say, Honolulu, and there's the Epicurve for Honolulu. Over the past 7 days, we're averaging 32 new cases a day over the past 7 days. Really a cool tool. And then this guy, what's this guy?
That right there is the date filter. So you can shorten the dates to see if you want more recent data, more recent daily case counts, and just get a zoom in of what's currently happening or what's happened in the past couple months or so.
For quite some time, we've emphasized that trend line, the average running 7-day average, because we have predictable variation from day to day. You'll notice the Tuesdays tend to be larger numbers, the Sunday and Monday tend to be smaller numbers. That reflects the reporting and when people get tested, how people access healthcare related to medical offices being open or not open, lab testing facilities. But the thing that stays stable over time is the 7-day average. And so when that 7-day average starts to creep up or creep down, then we know that that's a reliable trend.
And we have always said that trends are more important than single days, because in any single day you can see a sharp increase in the number of cases or a big decline. And like you said, it often depends on the day of the week, right? I mean, the numbers we report on a Monday reflect things that happened a couple days earlier. So interesting to watch. Watch the trends, everybody. Watch this red line. The trends are what are really important. Okay, we continue on. County rates.
And here for county rates, you have the option to compare on the left side. You can select a county. You can choose as many as you want that you'd like to see, or you can choose 1 to 2, just if you wanted to compare and see how these counties match up against each other. So this one is by island, so you can choose one island or multiple islands at a time to compare. And these are over by the island's population. So it kind of takes away, population changes between island that might account for total case counts.
Okay, just one more tab to click on here. In the bottom right, we see the testing button, and I've clicked on that. What are we looking at?
So here we have the testing dashboard, which shows us the daily testing counts per, like I said, daily testing counts. And it shows us the negative and positive per day, which you can hover over and see how many tests were done each day. It gives you the 7-day averages at the top. And then the deep purple line shows you the 7-day average over time, which you can see if you hover the percent positive for that 7-day period. And then you can also, on the left-hand side, select a county if you're wanting to look at a specific county and see how their percent positivity has been doing. Recently, we've noticed that there's been a decrease in daily testing, which is likely attributed to the relaxation of travel restrictions.
Okay, I'm going to scroll down to the next page here on the dashboard, and this one is pretty much all about vaccines.
This is where we can find information about how the state is doing in vaccination. It's updated every day, and a lot of the questions that people are asking, whether it be about the state or each county, can be answered by hovering. And so here we see the statewide progress in terms of the total population is standing at 58.1%. And that's an important metric that we're tracking as we think about reopening. And then that's based on 1,703,620 doses. We also can be interested in, tracking progress towards benchmarks, as well as how the individual counties are doing. And that metric on the left, there's a selector there that lets you choose, are you interested in the people who have completed their vaccine series already, or are you interested in people who have just begun their vaccine series? Because those numbers will be higher. And then we can also compare, rather than the total population, we can ask, what is the percent of people who are eligible? And so from this, this kind of represents all the people who are eligible, what percent of them have at least gotten one dose. And these are really excellent numbers. 75.8% of the state's eligible population has initiated their vaccination. And county-wise, we can see 74% for Hawaii County, 77% for Honolulu County, and so on. And this represents, we've reached many of the people, and there are still a good 20 to 27, 29% of people, depending on the county, who are yet to receive the vaccine. And, we hope that they can make that decision as they get educated and as they find out the best way for them to get vaccinated.
This is the end game number that we pay attention to, right? The completed number, and it's complete. It says completed here. I picked that under status and total population. Instead of 12 and above, or those eligible, I need to look at the total population, because again, everyone in the population can be infected with COVID. Everyone can carry COVID. And while young people don't get as sick as older people, they can be infected. They can transmit the disease. They can carry the disease, and they can infect others. And often they can infect older people who can become seriously ill or worse. So we watch the total population, and the completed is so important because we're all trying to get to that 70% when the state is going to open up travel restrictions. The safe travel programs the safe travels program will disappear at that point. So we're watching this. We're at 58.1% now. That's completed vaccinations of the total population. If you go to initiated, that number is going to jump up to 64.7%. The good news is that 64.7% have initiated, and you think that, look, if you've initiated, the vast majority of those people who have initiated will soon complete. And so hopefully this, in the next 3, 4, 5 weeks, our completed number will be very close to the 64.7%. And I guess it's fun to look at the 12 and older population.
Let's look at the map. I think that's a feature that was added fairly recently. And, I've talked about it in some previous ones, but we're tracking this because, previously we identified where are the areas with high versus low vaccination rates within a county at the zip code level. And, we're really hoping to see that the outreach efforts that are being performed in the communities with the communities can have some benefit and show some results so that we can see those lower vaccination rate counties and areas increasing over time. It's also important when we think about risk, I'll mention that if you click on initiated, this is where you can start to see some of the progress having been made, because the initiated bar is our first early indication. And if you jump back to Honolulu County, we can see, a lot of these areas were well under 50, 45, even under 35% previously. And, we've seen them kind of make their way up the color gradient on the initiated, and we hope that the completed will follow. It's also important as you think about, risk in these communities. In pockets, the state or individual communities can achieve high levels of vaccination, as you pointed out, where we'll see disease transmission in those areas probably drop to near zero. And at that point, the disease transmission will be localized to the pockets of unvaccinated community members. And so disease risk does depend on where you are, who you're with, and their vaccination status.
And we've seen that across the country, really. In areas where the vaccine has been well received and there are high vaccination rates, there are low disease rates. And in areas where people have not yet been vaccinated in great numbers, that's where we've seen the larger clusters and the larger outbreaks. But we've been going on for a long time now, but there are more things to look at, including age. We can zip through them. We see that the older people are, the more likely it is that they've been vaccinated.
That's right. And it also shows us, which groups still have the most progress yet to be made. So it's excellent that our Kupuna and those groups that are at the highest risk of more severe outcomes are protected. And that's going to put us in a really good position to avoid unnecessary mortality in the state. But, there's still lots of opportunity for transmission to occur in those younger unvaccinated populations.
Okay, and race. There's also race data where we can look at the different ethnicities and see, are there some trends there? Do we need to address certain populations?
Yeah, and in this view, it's a little bit different. These percentages are representing the percent of vaccine recipients and how that compares to their share of the population. We do have some limitations in the availability of this data. We don't always have complete information reported to the Department of Health about the vaccine recipient, but we try to use the data that we have to make some conclusions and try to learn where more work needs to be done. And so what we find is that the Native Hawaiian and Pacific Islander communities in the state are underrepresented among vaccine recipients compared to their share of the population. Although we have seen some really great progress in that area, we've seen rates increasing in those groups in recent weeks and months. And so we expect that gap to close as those activities and that outreach continues.
Guys, some fantastic information available on that dashboard. And again, all I did was I went to Google and I typed Hawaii COVID data, and it popped up pretty quick for me. I was able to find it. You can spend hours messing around on that website. I suppose you guys have spent a few hours putting all this together. And I appreciate all your time here today. Thanks for all your hard work. This information guides the efforts at the Department of Health. It tells us where we need to do testing. It tells us who and where we need to offer vaccines. And this is good information, and it's great that it is just so apparent to the public and it's so transparent and available to the public. They're able to kind of keep up to date with us. And I know a lot of people are watching it because they ask me some pretty smart questions.
Great. Yeah. And just want to say thank you to Haley. She's done a lot of great work in helping with these new updates to the data. And we really hope that people find it more accessible, easier to get their questions answered. And, we encourage people to check in, maybe it doesn't have to be every day, once a week, and just find out what the current situation is in your area. And that's what we want this data to be available for.
All right. Josh Quint and Haley Maeda, thank you both very much for all your time. And everyone out there across Hawaii, thank you very much for watching. Please get yourself vaccinated, protect yourself, protect your family, and let's drive hard toward that 70% where we can even open up further and we can see those case counts drop, because that's what it's all about. We will all want to get out of this pandemic desperately. So thank you, everybody, and we'll see you again soon here on the Weekly Dose.